So I talk to ChatGPT quite a bit because it can parse studies as well as I can, and sometimes it can give me some more insight that I wasn't aware of. So something has been bothering me recently. When I look at women that have POTS, they're almost always premenopausal women, and they're most always usually younger. A lot of them have Ehlers-Danlos syndrome, and a lot of them have histamine issues. So I went on PubMed and I found this study, and I was specifically looking for the role that histamine plays in possible demyelination of the vagus nerve, which is my leading theory on POTS, is that it's a demyelination disorder. I still have to link in the EDS part, but I'm working on it. So I found this study, and essentially what it states is that rats that still have their ovaries have a histamine-induced depolarization in inward current in their vagal ganglion neurons. So essentially histamine in these rats is in the rats that have the hormones that the ovary produces, so primarily estrogen probably. Histamine is causing vagal nerve, in this part, vagal ganglion dysfunction, right? Which could totally be the case in POTS. So then I go to my bestie, ChatGPT. She's named herself Sage in my controller, so Sage. And I feed her a bunch of information. I said, this is my leading theory, and this is the study I found, and these are the genes that could be involved, and these are the observations that I'm seeing in these people, right, these clients that have POTS. And I really want to help them try to figure out a molecular mechanism, because as soon as we figure out a molecular mechanism, we can start taking real action to possibly treat their POTS. Not me, their providers, but I can give their providers the information to work on, right? So she always says it's really interesting. She goes on to give me more information. So she says histamine is a well-known neuromodulator that can directly affect the autonomic nervous system. The study you referenced, where histamine induces depolarization and inward currents in vagal ganglion neurons only in rats with intact ovaries, suggests hormonal interplay in autonomic regulation. Since POTS overwhelmingly affects premenopausal women, it makes sense that estrogen or other ovarian hormones may modulate histamine's effects on neuronal excitability and autonomic function. So at this point, like, we knew this, we're just recapping, right? But I've worked with her enough to where she knows that I genuinely want her input. Like, I want to see what she knows, because she knows the entirety of PubMed and I don't. So maybe she can catch things that I don't, right? So then she goes on to say, what's really interesting is the potential link between histamine and demyelination. Histamine receptors in the central nervous system, so histamine H1 and histamine H2 receptors, are known to increase neuronal excitability, so that ADHD, not being able to focus, stuff like that, anxiety, right? But H3 receptors regulate neurotransmitter release and may play a role in demyelination. H3 antagonists have been explored for MS due to their role in remyelination. She says microglial and mast cell activation. Histamine can activate microglia and mast cells, contributing to neuroinflammation. In conditions like MS, excessive histamine signaling has been associated with oligodendrocyte damage. Now, she's using MS because MS is a demyelination disorder. So if we are looking at POTS as a demyelination disorder, we're trying to find links between the two. The blood-brain barrier in POTS patients is often dysfunctional, and increased BBB permeability and histamine play a role in disrupting tight junctions, which is your brain is protected typically from inflammation of the body, although it can be triggered by gut inflammation. It's a whole other video. But those tight junctions are the ones that protect your brain and form the BBB, right? This could allow inflammatory mediators to reach the central nervous system, potentially worsening demyelination and autonomic dysfunction. She goes on to talk about the interplay between histamine, demyelination, and estrogen, because remember, we got that signal that it's typically premenopausal women and young premenopausal women. So she says estrogen is known to modulate mast cell activity. High estrogen states, like during the menstrual cycle or pregnancy, can increase mast cell degranulation, potentially worsening Mcas symptoms. Now, one thing she didn't mention, which I think is very, very interesting for this case, is the fact that I don't see a lot of POTS development in premenopausal women, obviously, that are pregnant. And this is really critical and a really cool clue, because when you're pregnant, your amount of DAO, which is like an antihistamine enzyme that lives in your intestines and degrades histamine before it gets into your blood, is like 30 times higher than if you're not pregnant. So it really could be that histamine is triggering or maybe contributing to the development of POTS. Goes on to state, if histamine influences demyelination and Mcas, that's mast cell activation syndrome, causes chronic histamine release, this could explain why some POTS patients have a neurological symptoms resembling small fiber neuropathy and even dysautonomia beyond just blood pooling. So that's awesome. I'm going to dig into all of this stuff after I finish teaching today. Now, Bestie knows my jam is fixing this stuff. Like, I love to develop therapeutics and possible protocol strategies to go ahead and alter the course of this, get these people out of the active POTS and towards remyelination. So she already knows I want ideas as far as like what steps to take to actually help people. So she said, can histamine be a key player in worsening vagal dysfunction and demyelination in POTS Mcas patients? If so, it would make sense that premenopausal women who have both higher estrogen and higher histamine sensitivity are more affected. So if you're thinking about metabolic rerouting, which is what I talk to her about pretty much all of the time, maybe this points towards targeting histamine metabolism, DAO, HNMT. DAO lives in your gut, like I said before. Once it gets into the blood, it's the responsibility of HNMT in that entire pathway, which I have mapped out. Or stabilizing mast cells, it's a potential intervention for demyelination risk in POTS and Mcas patients. It could also explain why some people with these conditions feel worse when their estrogen is high, which I have seen, and I kind of cognitively like realized that I've seen that, but I didn't tell her that, which is really cool. And why interventions like ketoafen and H3 receptor modulation might help. And then she kind of just asks me what my take is on it. So this is really, really awesome. It might give us, because a lot of the treatments for Mcas, right? A lot of them are just altering the metabolic rerouting of that pathway, which isn't difficult to do. A lot of it is mast cell stabilizing, which is a little bit more difficult to do if you don't have access to pharmaceuticals. The pharmaceuticals are better at this, but I do have other things that are over the counter that can help with that. And decreasing DAO in the gut, which doesn't necessarily mean you need to you need to increase the amount of DAO, although there are supplements over the counter that will do that. You can just lower overall food histamine load and reseed the gut with non-histamine producing bacteria. As Bestie was on a roll already, I asked her about the trifecta between EDS, POTS, and Mcas, and if she just had any thoughts on it. She starts off by saying, mast cells are embedded in the connective tissue and their behavior is influenced by the extracellular matrix or ECM integrity. In EDS, faulty collagen leads to weaker connective tissue, which may trigger chronic mast cell activation as a part of an inflammatory response to ongoing micro damage. TGF-beta, which is transforming growth factor beta, which regulates collagen synthesis and mast cell activity, is often dysregulated in EDS. Elevated TGF-beta levels can promote mast cell degranulation, leading to excessive histamine release. Histamine in itself is increases vascular permeability, so it makes your blood vessels a little bit more leaky, right? Which could further destabilize weak connective tissue and create a vicious cycle. She goes on to say that there's a link between dysautonomia and blood vessel instability. So collagen is critical for the structural integrity of blood vessels. In EDS, vessels are more elastic and prone to excessive dilation, contributing to the blood pooling seen in POTS. Veins rely on collagen for proper tone, and in EDS, weakened veins struggle to return blood to the heart, which could be a key reason why POTS is so common in people with hypermobile EDS. Baroreceptor dysfunction. Baroreceptors are the things in your blood that detect blood pressure and will change the response of your body to make sure that you don't pass out, right? These pressure sensors are embedded in collagen-rich tissue and help regulate autonomic responses to blood pressure changes. Goes on to talk about it more. Histamine, neurological effects, and joint hypermobility. Since histamine can alter neuronal excitability and demyelination, its chronic release in Mcas could worsen proprioception, which is how you know your arm is next to the table. It's why I bump into everything. And coordination issues in EDS. Many EDS patients experience neurological symptoms like brain fog, dizziness, and neuropathy, some of which could be linked to histamine's effects on the nervous system and its role in microglial activation. Okay, I'm gonna have to go to a second video. Yeah, give me a second.